Welcome to our monthly webinar series hosted by the Office of Integrated Healthcare Research and Policy in the Department of Family Medicine at the University of Colorado School of Medicine. Let me begin by telling you a bit about our sponsor and partners. This webinar series is sponsored by the California Mental Health Services Authority Integrated Behavioral Health Project. CalMESA is an organization of county governments working to improve mental health outcomes for individuals, families, and communities. Prevention and early intervention programs implemented by CalMESA are funded by counties through the voter-approved Proposition 63, the Mental Health Services Act. Prop 63 provides the funding and framework needed to expand mental health services to previously underserved populations in all of California's diverse communities. The AHRQ Academy for Integrating Behavioral Health and Primary Care functions as a coordinating center and national resource for people committed to delivering comprehensive, integrated healthcare. The Academy focuses particularly on integrating behavioral healthcare into primary care practices and promotes a collaborative environment that fosters dialogue among leaders and other stakeholders in integrating behavioral health and primary care. Key Academy tasks include the NIAC, National Integration Academy Council, an expert panel of nationally recognized leaders in integrated healthcare. The Academy web portal and literature repository, where there are over 1,900 citations, the recently developed lexicon for behavioral health and primary care integration, and so much more. Visit www.integrationacademy.arc.gov for additional information on the Academy. The Collaborative Family Healthcare Association is a nonprofit, member-driven collaborative organization in existence since 1995. CFHA promotes comprehensive and cost-effective model of healthcare delivery that integrates mind and body, individual and family, patients, providers, and communities. Advancing Care Together, a project of UC Denver Department of Family Medicine, is a 4-year program aimed to discover practical models to integrate mental health, substance use, and primary care services. The program, funded by the Colorado Health Foundation, has funded 11 demonstration projects that have been organized as a set of diverse comparative case studies and will be linked to support cross-project learning. Before introducing Drs. Lee and Sevilla, I would like to go over a few housekeeping items for GoToWebinar. You can hear the audio by selecting the telephone and dialing in or simply listening through your computer speakers. Drs. Lee and Sevilla invite you to ask questions throughout the presentation by typing your question in the questions box. And we will also hold a 5 to 10 minute Q&A session at the end of the webinar. Today we are pleased to bring you Drs. Lee and Sevilla. Dr. Jay Lee is Associate Medical Director of Practice Transformation at Memorial Care Medical Group and Assistant Program Director/Director of Health Policy at the Long Beach Memorial Family Medicine Residency Program. Dr. Lee is board certified in family medicine and is an assistant clinical professor at the UC Irvine School of Medicine. Dr. Mike Sevilla is a family physician in a full-time private practice in Salem, Ohio. Dr. Sevilla is a national speaker on social media topics and holds an appointment of Assistant Professor of Family and Community Medicine at the Northeast Ohio Medical University. Social media is a powerful communications medium for primary care and for mental health issues. Today, Drs. Lee and Sevilla will discuss how to utilize social media for patient education, how to dispel medical myths, and how to use social media for community and legislative advocacy. Welcome, Drs. Lee and Sevilla.
Well, thank you, Jesse, for that great introduction. Before we get started, I do want to thank our good friend, Dr. Ben Miller from the University of Colorado for the invitation to speak, and big shout out to our good friend, Dr. Mark Ryan out in Virginia, who was not able to join us today. So, Dr. Lee, how are you doing, sir?
I'm doing well. Thank you. How are things out where you are in Ohio?
Oh, it's a balmy 21 degrees Fahrenheit here, and but it's not the -20 that we had here last week. But I'm very excited about our topic today, and for our friends and people who have seen us speak before, we love talking about social media, especially when it has to do with medicine. So I know we have a whole lineup here, Jay. Do you have any opening remarks for us before we kind of start on our topic?
Uh, Not too much other than to say that this is, both of us are very busy clinicians, and it is something that over the last several years, as social media has grown in terms of its influence and its scope, we've seen more and more organizations embrace it as a method of engaging with patients and populations. And so both of us are hoping that we can provide you with that perspective, and for those of you that are relative novices, to encourage you to get involved, and for those of you that are on the Twitter and the Facebook and the other social media platforms, to encourage you to continue to tell the story of primary care and the story of mental health integration in primary care.
Yeah, and as we get started, I don't know if Jesse can kind of make our mugs bigger here by taking off the slide there, and we'll be able to get started. And as we do get started, I do want to say something right at the top here, is that neither of us use social media for any kind of clinical use. I mean, I don't email with patients. I don't text message with patients. What you are going to see today is how we use social media as a communications tool for things like patient education and advocacy and those type of things. But Jay, the first question I usually get is why social media? Why is social media important? And people always like to use data. And I always like going to our friends at the Pew Internet Research Center, Pre-Research Center for Internet and American Life Project. And they have a great section there called Pew Internet Health, and people can see that right there. And some of the data that they have there is that 85% of U.S. adults use the internet, and 91% of U.S. adults, they use a cell phone. 56% of U.S. adults use a smartphone. 72% of internet users say they look online for health information within the past year. And Jay, I know you and I have talked about this before, is that more and more of our patients are coming to us with questions from the internet. They're using their cell phones or using their mobile devices, and that's one of the reasons why social media, I think, is important, especially as clinicians.
Correct, and I think a lot of times, compared to say 10, 12 years ago when there wasn't social media around, the level of contact with clinicians was pretty much limited to face-to-face visits, handwritten letters, or a phone call. And I think knowing that the technology has really advanced in the last decade to allow for more access points with patients and patients with doctors, including in some EMRs embedded messaging systems and whatnot. We're certainly entering an era where patients are in this space, and I think the other thing to keep in mind is when patients are in this space, they're going to be looking for expertise, content expertise, or people to sort of help guide them to the proper resources. And certainly, I think more and more physicians have entered that space over the last, I would say, 4 to 5 years.
And a couple of other pieces of data I'm going to share with all of you is that 31% of cell phone owners and 52% of smartphone users have used their phone to look up health information online. But one of the probably the key statistic from this Pew Research Center Internet and American Life Project from this section is that 70%, 7 out of 10 U.S. adults got information, care, or support from a doctor, from their doctor or other healthcare professional. So even though there is a lot of information out there, Jay, I mean there is the American public, they still go to their physician, they still go to their healthcare provider for trusted medical information. Wouldn't you agree?
Yeah, and this happens to me all the time. I've got patients who'll print something out from the internet, and they either their spidey senses go off and they say, I don't quite trust the information that's out there, or they'll say, this sounds awesome, why haven't we talked about this? And there have been times when I've dispelled whatever myths were out there on the internet, on the interwebs. And then on the flip side, there have been times when patients have actually taught me about new and upcoming treatments or diagnostic things that weren't on my radar, but because they did the investigation, they were very engaged in the care that they are receiving from me, and I'm very open to that. I think that's really critical as we, especially as we're talking about mental health integration and the relationship building that we can do as primary care physicians with our patients. And having that open dialogue and shared decision making and motivational interviewing and all these methodologies certainly do help create that connectedness that a patient might have with a practice.
And we encourage you as participants out there viewing this webinar. First of all, thank you for taking the time today. But we encourage you to maybe type a question in the question box here, and we'll be trying to make this interactive there. And for those of you on Twitter, we have this nice little tweet from our friends there. Maybe it's backwards on your screen, but they are using the hashtag integration on Twitter, and I'll be trying to monitor that as well. And Jay did talk about primary care and mental health professionals. And Jay, you're right. I mean, I have seen over the past few years, not only physicians, particularly primary care physicians, but mental health professionals starting to utilize and be on social media for things like patient education. You probably have seen an explosion of people, especially our friends and colleagues, using social media for a number of things.
Yeah, and I think even it's funny because I think, and let me know if this was a similar situation with your hospital, but in the early days of the internet, everything was locked down. You couldn't log on to X site or Y site because of certain keywords or because it was a social thing. And in the last 2 years, I feel like those firewalls have started to come down a bit because they realize there's value for patients to receive information, and then not only receive information, but then to interact with the institution or the experts at that institution, but also find other patients like them who might have similar issues going on, and to be able to kind of share that out in the open, and this is by the patient's own decision to share this information. Sometimes that does create a community, whereas sometimes, let's say with a chronic disease, sometimes you might feel isolated or alone, or why me? Why am I the only person with this disease? And then suddenly you realize that there is actually a whole community of people that are out there.
And we can start start chatting about some of the uses, which we get a lot of questions about, and the things that I use social media for the most are for things like patient education and to dispel myths and dispel stigma, which are great topics for primary care and for mental health type of issues. I tell people when I talk on giving presentations and things, there are things that I say 15 times a day in the exam room talking to patients, things like this is why the flu shot does not cause the flu. And I mean, I don't know about you, but Jay, you're probably run on time, but sometimes I run a little bit behind in my schedule, and it would be great for me to say, the short answer is no, it does not cause the flu. But I recorded this YouTube video with some research, with some data, just for you to kind of look at, to review, and then when you come back in on your next visit, then we can talk about vaccines. We can talk about other types of clinical issues. We can talk about cholesterol medicines like statins. Those are a couple of examples that I use social media for patient education. Jay, do you use social media do you have any examples of that you use in your practice?
Yeah, there's a campaign that my health system uses that I think is very effective, and what it is it's you'll have a picture of food A in one side of the slide or picture, and then on the other side you have food B. And what they'll do is they'll provide some information about which food is healthier, which food provides more value in terms of per dollar amount of nutrition that you might get, say fiber or whatever it may be that they're particularly interested in. And they put it into a square format, which fits beautifully into Instagram, then gets cross-posted to Facebook and Twitter, and then the magic happens. You'll see patients start to interact with that, leave comments, ask questions, and there is someone curating that dialogue so that we're getting people to interact, and then all of us, truthfully start to have conversations that they can bring into the exam room. Hey, doctor, I saw that thing on Instagram about pomegranate. Tell me more. I'd like to know if that's something that I can utilize in my diet, that you think it might help me. And that's a great springboard, a great place to start with patients. And I think that additional information is certainly helpful for getting that dialogue started between the doctor and the physician.
And another use that I've seen and that I've used myself, and Jay, you alluded to this earlier, is the idea of dispelling myths and dispelling stigma, which is a huge thing, especially in the mental health community. People talk about that, the way that mental health diagnosis patients are portrayed in media, like television and movies, and on talk shows and things. But the people and the patients themselves, have kind of been rising up and starting their own kind of, grassroots voice, using things like Twitter and blogs and Facebook, kind of telling their story a little bit. And there's also specific patient advocacy sites, like Patients Like Me and We Go Health and WeTribe.com, that are out there where people can go to join a community who are similar to them. And what I tell people when I talk to them is that I go and I also go and join these, but I don't go and saying I'm Dr. Sevilla and this is what the right medical information is. I go to listen. And I think that's very important because, especially if you're a primary care physician, a family physician, the best thing that you can do starting out, especially when you're not really familiar with things, is to listen, to be a good listener. And that's how I learn, and that's how I can share with my patients. I said, hey, my patient said the other day, hey, I learned this on the internet here, and I'm like, oh, well, I learned this on the internet from a site that has value to me, that has people that really, have the disease, and they share a conversation. So I know, Jay, but maybe even at your hospital system, maybe you have some virtual patient groups or support things that you have, so to do things like dispelling myths and dispelling stigma.
Right, and as you mentioned, certainly, mental health, mental illness can be very socially stigmatizing and isolating for the patients that are experiencing this. And so this gives them, patients, some control to be able to identify others who may be in a similar situation, maybe versus, say, reaching out to a family member who they might feel might judge them, or workmates who may not completely understand, but really truly finding that community. And I think that narrative that you talked about it's sort of an ongoing, it's like this one big, the internet's this one big long run-on sentence, right, of information and a conversation. But over the arc of time, what you really see is that the narrative of a patient, or the narrative of family medicine, or the narrative of mental health professionals can really play out, and that legacy, or that history that gets put out there, is what creates credibility and trust, and also keeps us very accountable, because we know that information is very public, it's out there, and we have a responsibility to be informative, to tell the truth, and also to show that we care, because that's the bottom line, is that we're in a caring profession, and oftentimes things can feel very transactional in this day and age of medicine, where it's not like the old days where my doctor really knew me, but we're trying to recapture that, I think, through social media channels, but also through new practice models like PCMH, patient-centered medical home. So I hope that answers your question, Mike.
Oh yeah, yeah. I mean, that's a great segue to the next really great use of social media. Is things like sharing innovation, sharing different patient care models, and different payment models for care. You talked about patient-centered medical home, and there's a lot of other uh, models out there, primary care and mental health integration models out there um, that I got to learn about. And a way for people to kind of share these things, even like the direct primary care um, movement or model that people are talking about in primary care circles right now. That's a great way for people to start learning that there are other alternatives to our broken healthcare system, not only from a patient care model, and there's also from a payment model as well. And I know, Jay, that you are all over that as far as being involved in those discussions, with legislators, with advocacy groups, and social media is a great way to get that information out there.
Mm-hmm. And actually, before I respond to that, it appears that we do have a question. So if I may put the question out there, and Mike, I'll have you go first, and then we'll have a little conversation about that, and then we
Sure.
can go into the part about advocacy. So it says family physicians have important information to share. With the sheer amount of content being produced every day, how do you cut through the clutter and reach your audience?
That is probably one of the most common questions that I get asked. And I had a different answer 6 or 7 years ago than I do now. Because now, social media, a lot of people are using it, which I think is a good thing, but it is much more difficult to differentiate yourself from other people out there. So, my recommendation would be, um, a lot of it is about good content. And if you do have good content, people will start to read it, but it's also kind of getting it out in your own networks and getting out and reaching networks is more than virtual. It is kind of going back to going to conferences, meeting people one-on-one, getting to know them getting to know you. It is much more difficult now to get your message out than when I started, because there's a lot of great people out there producing a lot of great content. It's a lot more difficult to get noticed. It's a lot more difficult to carve out something for yourself there. But the first and foremost is great content, and trying to do things that are innovative. Blogs are still the stalwart of social media, but there are so many out there now. People are starting to explore other types of things like video, like this GoToWebinar format, like Google Plus, like YouTube. There's audio podcasts. There's people using Vine. So you have to try to keep ahead of the curve on all these technology things to try to get your voice out there. But it's I don't have a great answer to that, but it does really start with really great content, and people will come your way if you not only produce good content, but produce it on a regular basis. Just with my job and with what I'm doing day to day, balancing family and work, it's getting more and more difficult to do that. But the people that are very well, doing very well, they have a way to produce good content on a regular basis, and they're very connected to a lot of people out there. So I hope that answers the participant's question. Jay, I don't know if you had anything else to add to that.
Yeah, I just wanted to add that I think the other way to sort of cut through the clutter is using sort of tools within social media like hashtags to help you identify individuals who have great content like Mike does, who share your interests, And as an example, family physicians share, one of the hashtags that we share, that how we find each other is through something called hashtag FM Revolution, Family Medicine Revolution, and it's a great way of building community. And I totally agree with you. I think that a lot of the relationships start on the interwebs through social media channels, and then you do end up meeting people at meetings, and then you can find ways to collaborate outside of that. And I think, particularly when I think about you and I and Dr. Miller and Dr. Ryan, that certainly was the way we ended up collaborating over the last couple of years, was that we all met each other virtually, and then we met each other, in IRL, in real life, and we're able to develop that professional and personal relationship out of that. And I think there's a lot of value to that. But I think hashtags are a really good way to identify that really good content that's out there. And not just the sort of generated content, but also the personalities and the perspectives that maybe different social media mavens might use.
So we thank you for your question, and we invite other people to ask questions to really make this real time and interactive with all of you out there. And so I know, Jay, that you love talking about advocacy when it comes to social media. So when people ask you, hey, Jay, how can I use social media for advocacy purposes? What do you tell them?
Well, it's like any other policy initiative or any other sort of way to get people to change. There has to be some sense of urgency. And certainly in healthcare, there are things like implementation of the Affordable Care Act. There are things like, which I think, one thing that I think we're going to see a lot of issues around is access. Just because people have a card to access healthcare doesn't mean that there's a sufficient workforce to provide the care that's needed. But one of the best examples that I can think of is getting the information out about things that are happening in one's community. And when I think about what happened in Kern County, California, near the Bakersfield area, there was an imminent, there was a business decision to close a residency program. And the word got out via social media, and before you knew it, you had the county directors or the county supervisors were made aware of this. People were calling the hospital to find out what was going on, and then other communities, sub-communities within that greater community of Kern County came together and rallied in real life again. It started in the virtual world, but then it happened in real life, where they were successful in at least stopping the immediate closure of the program. And I thought that was a very powerful story for all of us, really, that we're not used to organizing in that way. But if there's something that's an urgent healthcare issue or an urgent access issue or urgent health system issue, this is the way to really find others who can help you, find others who could tell your story. I'm a doctor. I'm not really good at, say, voter registration. So if I need people to help me with voter registration to get up around an issue, then I have to find others who can kind of help fill that expertise, right? So I think that's really the powerful way that social media can catalyze change in the system. And yeah, not every story is going to be successful, but at least we're getting closer to perfecting this, and fixing the broken system that we currently have.
And when I get asked about that, I mean, it doesn't have to be a huge, enormous social media campaign. It just could be something really simple. There are advocacy weeks. There are things like, World Mental Health Day. There are things like, Mental Illness Awareness Week. And you can communicate, you can advocate, you can say, whatever you'd like, about the topic that you're passionate about. And Jay talked a little bit about hashtags earlier, and you can kind of let your community know that you're going to be doing advocacy on Twitter or Facebook or whatever, using things like hashtags, during that week. In our community, National Primary Care Week is huge, and we try to raise awareness about why we believe every American should have a family physician. And we talk about it, we tweet about it, we write blog posts about it. So those are some of the things that I tell people about advocacy, which kind of leads into our next question here that we have is what types of information are most impactful to communicate over social media? And Jay, I'll have you go first on this one.
Sure. That's a really great question because you could move in so many different directions in terms of the type of information that's out there. I think you alluded to this earlier, and it's information that you repeat often to many people. Can be really helpful to include in tweets or Facebook posts. A really good example of this is in my wife's office, they have a Facebook page. She's a pediatrician, a general pediatrician, and they will periodically put information out there about things like head injury in sports. When should I? What is a concussion, and when should I go back? Or pediatric fever, as an example. And these are things that physicians and clinicians will repeatedly. Everyone's got their spiel, right, of what they'll say to patients. But by having something sort of packaged and easily, I guess, pushed out into those communication channels, as you're noticing maybe anecdotally that you're getting more of those questions, you can refer people back either to the website or to the Facebook page or to the Twitter account or to whatever other platform that you're utilizing to get that information out to people. So it can be sort of what I would say regular clinical communication that you would give to patients. It can also be information like, hey, we've got the flu shot now, which is a seasonal thing. Or it can be around things like, kind of what's the best way to get to be a patient to get the most out of your visit. As an example, we're in the midst right now in my group of working on a shared decision-making educational campaign to let patients know that it's actually okay to be as involved as you're able to in your care, that it's not the old model of the doctor who in the white coat who says you must do X, Y, and Z, that the patient actually needs to be very, very involved in the decision-making when it comes to diagnostics and when it comes to making treatment decisions. So I would say those are probably the big areas that I've seen practices utilize, and certainly in our own practice, those are things that I see that are out there.
And when I get asked this question, I mean, this question can be interpreted any of a number of ways. I mean, I have seen, very powerful videos made to tell a story. But the drawback with that is it takes a lot of time. You need to know people who know how to do that type of thing. So when I get asked this question, I tell, especially for trying to get resistant people to use social media, like clinicians and physicians, who are the most resistant people. So when I tell people, what is most impactful is something that is fun. It is something that is easy. And what I have seen is that people use photo campaigns very effectively. Like, some people I've seen, when in the fall, when they get their flu shot, they put a picture of them, getting a flu shot on their Twitter or Facebook, and that can send a powerful message, a very simple, very powerful message. You can take a photo just with your smartphone, and if you get other people doing that, not necessarily nationally, but people in your own community to get that message out. And I've seen other types of photo campaigns. Something that Jay and I are involved with is, this is probably backwards on your screen, but it says, 2014, the year of the family physician. And what I've seen people with this campaign do is they take pictures, in their clinic. They take pictures with their patients, saying, just trying to be an advocate for primary care, trying to be an advocate for family medicine. So if you want a kind of a quick and easy way, to try to get the message out, it could be something simple like that. But if you know people, or you have access people, or you have the talent to do things like podcasts and videos, and really creative Vine videos or Instagram pictures, you can do that. But it doesn't have to be complicated. It doesn't have to be overwhelming. But it's something that people have fun with, and it's relatively easy to do. And usually, picture campaigns are a good startup to get your feet wet when it comes to social media. So Jay, I think we have another question, and this is very exciting. How we're getting people to get interactive here. What's our next question?
So it says, for small busy practice, where or how do we produce relevant information on a consistent basis? And what I would say to that is, if you truly are busy, and most of us are incredibly busy, and particularly in smaller practices in areas that are underserved, certainly people are queuing up to come see those providers. Time is an issue. And so what I would say is, if you're on that spectrum, the way to sort of think about social media is that you're not everything to everybody. There are going to be some people that are, I guess, further up the developmental chain that are producers of original content. And then there are going to be others who are not as far along, not because they don't want to, but just for practical reasons, time, other commitments, family, etc., that can actually utilize those things like hashtags to find pertinent information that resonates with who they are, and allows them to then find little snippets. So for example, during this flu season, there's been a variety of articles that have been put out there in the Atlantic and the New Yorker, in some of the local news stations about the number of flu deaths that have occurred. And I've seen people post that on social media. And again, that's not a original content thing, but what you're doing is you're sharing it and then providing your perspective on it as a clinician. And certainly that can be used for things in the mental health realm. It doesn't have to be just flu, but it can be around depression, or it can be around PTSD, it can be around ADHD. There's a variety of things that ways that you can find content that's out there and then utilize it for to get your message out.
Yeah, this is an interesting question for a small busy practice. Where or how do they produce relevant information on a consistent basis? You really have to. Time is obviously a huge factor, but you have to find, and it may not be easy. You have to find somebody who's very passionate about social media. You can't. The worst thing about trying to produce social media is producing bad social media, because you really can't fake it. So there has to be people in your community, people in your practice that can help you with some of this. Now, as far as content goes, a funny story that I share with people is that what I find out is relevant content is the information that my patients are looking at on their smartphone when they walk into the exam room, because I know that is something that is very relevant to them. And that's what I tell people. You don't have to make something that's relevant nationally. You have to make something relevant to your local micro community. And there are things like influenza outbreaks. There are things like meningitis outbreaks. Or if your community is experiencing a lot of post-traumatic stress disorder, or a lot of substance abuse issues, depression, anxiety. Those are type of things that you talk about every day in your office or in your clinic. And depending on how technically savvy you are, sometimes I have or I suggest people, they have a smartphone. Sometimes they know how to use the video record function, and to have their physicians and clinicians talk about some relevant issues. It doesn't have to be a 50-minute talk like this. 2 or 3 minutes. What are some of the high points? What are some of the things that people need to recognize? What are some of the resources in your community to do that? And usually, if you do have a smartphone, it's very easy to post up to, things like YouTube now. It's not as technically difficult as it was a few months ago or a few years ago. So I hope that answers your question. But yeah, time is something that is you can't control. But hopefully, if you can find people who know about this stuff, who can help you with this, even some of the teenagers in your practice, or teenagers of people uh, who work there can help you with this. It's a great kind of mentoring type of relationship that you can get with people, and it can, because bottom line, I mean, it is about patients, it is about your community, and it doesn't take a lot of time, but you sometimes do have to block out some of that time to do this the right way. Let's see here. Yeah, we do have some time here left. So a couple more uses that I do want to talk about social media, and of course, feel free to type more questions into the questions box here. Social media can definitely be used to generate conversation, not only on social media, but also, kind of in real life. When it talking about mental health issues, there's always, articles that come out about mass shootings and mental illness. Not that we're taking a stand one way or the other, but those are articles that generate conversation. And I think that is a great use of social media, no matter how you feel or what spectrum that you're on. Social media is an effective way for people to express how they feel on some of these issues, and I've seen it, used very effectively for that. And social media can, help you understand the opposite point of view and that's what I use social media for. Is I may disagree with you, but I understand your point of view. I still disagree with you, but I have a better understanding of what your point of view is. So what do you think about that, Jay?
Yeah, I think it's sort of funny because I think particularly in this very polarized, politically polarized world that we live in, the art of dialogue, the art of making an argument, and then the person with whom you're playing mental tennis, then being able to lob back something at you, or hit it overhead. Sorry, using a sports analogy here.
Nice.
But the concept of having that dialogue and the value in that that needs to happen in the public space, this is sort of where it happens these days. And there are what we would call what people in social media call trolls. There are people that are out there just to push buttons and to not really truly have dialogue. But I think for many of us, we're looking to interact with others, to have a dialogue about what the issues are, and to understand the nuances. Because the truth is, there's a lot of nuance in many of these issues. It's not just we must have the Second Amendment or we must have gun control. There's got to be some discussion in between. There's a space there that and there's a gap right now on a society level that we're not really having those deeper discussions. And social media can be an initial place for those things to start. But then I think, in quote unquote in real life, those things need to happen as well. And that's really how we get better as a society. And it also helps me understand also around controversial topics in healthcare. So, for example, vaccines are controversial. There's certainly a lot of dialogue about that. And then there's also things about, GMOs or genetically modified foods or raw foods. There's a lot of discussion around health benefits or not, or is it a public health issue? And so I think it provides for a safe place for people to talk, and then to if they don't have the time to do it right off the bat, say when they're coming out of a Whole Foods or a Trader Joe's, that they can kind of do it in a non-congruent time period that will allow them to think a little bit more about what they want to say.
And we have another question. We want to thank everybody for their questions during this webinar. It's been great for us to respond to all of you out there. This goes: are there ever any copyright or privacy issues? How does a practice/physician protect themselves? And this is a very common question I get as well. There are definitely privacy issues, patient privacy issues. If I had another hour, I can show you all kinds of examples of why that is, where, where physicians and clinicians have been fired from their jobs when they think that they have shared a kind of anonymous patient information on Facebook and Twitter. So that's why I don't do any kind of clinical work on social media. I don't tweet with my patients or Facebook or text or anything like that. And how does a practice slash physician protect themselves? And also hospitals and clinics. I recommend looking into what is called a social media policy, and what does that entail. So say you're at a clinic, or say you're at an office, and one of your coworkers talks about the practice or talks about a patient at the practice. Do you have policy stating that that is not good, that is frowned upon, or even that can threaten your job? I know a lot of hospitals have gone to this because there is no policies out there as of a few years ago. Where can people look for examples of hospital-based social media policies? I usually turn people to the Mayo Clinic and other big institutions, like Cleveland Clinic. Also, they also have examples of social media policies for employees and how to deal with those type of awkward situations, because you hear them on the news, and you hear them on the news because a lot of those hospitals don't have a policy, so they're kind of dealt with, well, how do you deal with this employee who was talking about the hospital, who's talking about patients, who's talking about a coworker on social media, and it becomes a very awkward situation. Jay, you have thoughts on this question?
Yeah, there's certainly privacy issues, HIPAA-related concerns, and there have been very well publicized cases, as Mike alluded to. And I think the best way to address those is to set some guidelines. I think the social media policies are not meant to, I guess, restrict creativity or restrict expression, but certainly when it comes to patient privacy, it's really critical that we protect our patients from being identified in any way, shape, or form. And certainly in smaller communities, that's more of an issue as you're posting things. And my general rule of thumb before I will post anything is to kind of ask myself, are there any identifying things here? Are there any things where somebody can kind of go back to this and say, oh, well, you were talking about patient X, and that's usually when I just stop myself, and I don't even go there at this point. I don't think about that. As far as copyright goes, what I would say is if it's out there on the interwebs, and if it's being shared by an organization openly on a social media platform, then it's fair game for you to share that. And a lot of times we'll do things like we'll H/T something. It's a hat tip, or we'll RT, or we'll retweet. But it's a way of sort of acknowledging that you got the information from someone else, and certainly you want to be a good community member. And so if you do see something that's awesome that's posted on someone's page, like say for example the link to register for this webinar, I saw it posted on Mike's page, and I said, okay, I'm going to share that, and I shared it on my page, and certainly, I gave credit to him. I said via Mike Sevilla, and being a good community member is certainly part of it, so that you can continue to build bridges.
In our remaining minutes here, I did want to cover maybe a couple other topics. If people have questions in our remaining moments, please type them into the questions box. This is working out really well. So kind of looking into the future, can social media be used for like diagnostic purposes? And people may have seen in the news, or I have this article here. About a study from the University of Missouri published in the journal Psychiatry Research, and they've shown that social media profiles may or can provide insight into the mental health of patients, kind of viewing their Facebook timeline, Facebook profile, their pictures. Sometimes that can give you a little bit of a window into their psyche, and I think that's an interesting thing. I think more research has to be done with that. I know in the clinical world, that is also being looked at as well. For example, if there is, a influenza outbreak or something like that, and you see a lot of people in the local community saying, "Oh, I have influenza," or people on a Facebook page saying, "Hi, oh, we have influenza," or I've also seen it saying, "Oh, well, there's an outbreak of meningitis in our community," and people in that community using social media to communicate that out there. So I'm really starting to see social media used in some of these, clinical settings, and I think that's very exciting. You have thoughts on that, Jay?
Yeah, I think it's metadata, right? It's a way of say utilizing a hashtag influenza as a proxy for what we think is going on out in the community. And I know that the CDC certainly has I think it's CDC Flu at CDC Flu where you can follow sort of the latest and greatest data, and I think they do collect data around the number of hashtags in different communities, and you can kind of get a sense of what's happening at the very granular county by county level. I think there's a lot of opportunity here. Social media is sort of like the Wild West. It's like unregulated. Well, we'll see with net neutrality and what happens with that. But it's generally not unregulated. It's as I mentioned, kind of this long run-on sentence of people just continually putting information into a stream or thoughts into a stream, and at any given time, that stream might be flooding or it might be completely dry, depending on whether something has gone "quote unquote" viral. And it's very I think groups are starting to find ways of measuring just how engaged their community is, the population that they're serving, and using social media to kind of look at how many likes did we get for this post, and how viral did it go, because there are metrics for virality, not flu virus or not EBV or any of those other viruses, but virality of a social media piece, and then maybe exploring a little bit further with focus groups on why was that so popular, amongst people. Is that an issue that's going on in the community? And so I think we're just scratching the surface on how to use this in healthcare, in the healthcare space, and it's a wild, rugged, exciting frontier.
And the last concept that I'd like to share with people, and probably people know about it already, but if people don't, we'll try to explain it in our brief time left. Or as Jay said about the run-on sentence, and there are run-on sentences on Twitter that we call Twitter chats, and I will try my best to explain it. And is that people go to Twitter at a specific time to discuss a specific topic. And they usually use hashtags with that. And I did want to give a couple of shout outs, or a few shout outs here for Twitter chat, especially in the mental health area. There's the mental health and social media chat on Tuesdays at 9 p.m. Eastern time, and their hashtag is MHSM. And there's also the suicide prevention and social media chat, SPSM, that is Sundays at 10 p.m. Eastern time, and also breast cancer and social media chat Mondays at 9 p.m. Eastern time. And this is where the community goes to talk about these topics, and for people who may not be familiar with them, to start to learn and start to listen. Um, did I get that right there, Jay, about Twitter chats? Is that how you would explain that to people?
Yeah, I haven't been a huge participant in Twitter chats, but I think it's like a virtual meeting place for people to go and discuss issues that are salient to that community. And certainly, it's also another way of finding other people that have that have similar interests to you. And um, uh, because I've got three little kids at home, I really haven't been able to carve out as much time as I'd like for the chats. But I do know that my friends on social media do get a lot of value.
And we have one more question here. What are your hopes for social media and family medicine? How can we best mobilize each other to our cause and passion? I want to give a big shout out to my friend who I think I know who put this in there, so thanks. Yeah, as people know, Jay and I are family docs, and we feel very passionate about our specialty. We feel very passionate about our patients, and I've been doing this a lot of years, and my hope is just to kind of spread the message of family medicine, spread the message about why I'm a family doc and why I think every person in America, should have a family physician to share our story. Not only that, that our specialty is great, but we do have some solutions for our broken healthcare system. We have some patient care solutions. We have some payment solutions on how we can be a little bit more efficient. In this healthcare system, and mainly, just to have a lot of fun doing it. There's a lot of too many serious people out there, Jay, using this, and you can see that on social media. Just like you can see, just like you said, you can't fake it. But that's my hope is to kind of share our story. And these past few years, and we're slowly getting more people to listen and to interact with us, and it's been a lot of fun doing it. How would you answer this question, Jay?
Yeah, I'd go back to my tried and true Newton's second law. Force equals mass times not acceleration in this case, but amplification. And really the way you get people to change on a big level, to get to those tipping points where we see true social change, you got to create some societal force. And the way you create force in this case, I think, is um, by utilizing our voices, by utilizing our ability to provide content and expertise and storytelling, and to do it in mass, meaning it's not just Mike and I feeling good about putting stuff out onto social media, but it's entire communities of people creating a buzz. And by sort of being connected on social media, and by doing things like liking and sharing and dialoguing back and forth, that's how we create that amplification. Because we know for every like and for every comment that's put out there or retweet, that someone else is seeing that. All the followers of that individual person is seeing it. And so that's really where I think the power of social media is, that you can really amplify the voices of the people that are out in the community. And certainly the more of us that are out there telling the story of family medicine, telling the story of how the system is broken and how it needs to be fixed, and how that family docs have some ideas about how to make those changes happen. I think that's how we create the force, not just from a societal standpoint, but also from a policy standpoint as well. When you go to a legislator, you can give them a bunch of data, but ultimately it's the stories that really get them to listen to you. There's an often stated thing that you can create MIGO, my eyes glaze over, when you go to see a legislator if you're just presenting them with data. But if you have a compelling story, and you can tell it in a way that is succinct and captures other people's sentiments, certainly I think that's the way to truly convince people in the long run.
So before I turn things back over to Jesse, I did want to give people just some links for people to check out. The National Institute of Mental Health has some good stuff. The National Alliance of Mental Illness, NAMI, has good stuff. the Collaborative Family Healthcare Association. AHRQ has a good YouTube page, and also the American Academy of Family Physicians. So, Jesse, I think we didn't go over. So
yes. Thank you guys. Thank you, Doctors Lee and Sevilla, for a fantastic webinar presentation. I want to remind everyone that we will upload this webinar presentation onto our YouTube channel. You can see that link right there. And thank you so much for participating today. This was excellent.
Thank you.
Yeah, it was an honor.
Any final
Thank you.
thoughts?
No, it was a lot of fun, and thanks for the opportunity. And Jay, it's always great working with you there, buddy.
Yeah, ditto. And I would just encourage everyone to get involved and to be engaged. And we'll see you out there on the internet. And we'll look forward to interacting and meeting many of you virtually, and then hopefully in real life as well in the future.
Great. Thank you so much. This concludes our webinar series for the day.